Welcome to the Institute of Global Perioperative Care podcast, where we explore the people, partnership, and policies shaping the future of global health and perioperative care. I'm John B. Sampson, and in today's episode, we're focusing on the important work of the G4 Alliance. For those who may be unfamiliar, the G4 Alliance, which is also called the Global Alliance for Surgical, Obstetric, Trauma, and Anesthesia Care, is a leading international coalition of organizations and advocates working to improve access to safe, timely, and affordable surgical care worldwide. The Alliance brings together stakeholders across health systems, policy, advocacy, education, and implementation to strengthen surgical and perioperative care as an essential pillar of universal health coverage. Today, I'm joined by Neil Wertz, the current president of the Permanent Council of the G4 Alliance. Together, we'll discuss the Alliance's strategic priorities for the coming year, the opportunities and challenges ahead, and how global collaboration can continue to drive meaningful progress in surgery, obstetrics, trauma, and anesthesia care worldwide. Thank you for joining us, and let's get started.
Hello, here we have Dr. Neil Wertz. He's an Australian surgeon who represents an organization called Heal Africa and is the current president of the Permanent Council of the G4 Alliance. Dr. Wertz, how are you doing?
I'm doing well, thanks, John. Yeah.
Great. Where are you calling from today?
I'm calling from Australia at the moment. I'm back here at the present time. As you said, I represent Heal Africa at the Global Alliance for Surgical Obstetric Trauma and Anesthesia Care. Heal Africa is a Congolese not-for-profit organisation. I've been working in Africa, particularly in Congo, for the last 20 plus years. I first went there 2003, and I am now based usually at the Heal Africa Hospital. HEAL stands for Health, Education, Action in the Community and Leadership. It's a 310-bed hospital in Goma in eastern DRC, and I'm the consultant and advisor of surgical training programs. So I had a fairly major surgical practice in Australia. I was leading medical teams there every year for many years, multidisciplinary medical teams, predominantly doing training and upscaling. And then I realised that the more could be done if we were there longer time. So I finished my practice 10 years ago. My wife and I moved to Congo, and we've set up a surgical training program through the College of Surgeons of East Central Southern Africa, and we're training rural doctors in surgery, obstetrics, trauma and anesthesia care. We've started a program a few years ago because we realised that the rural doctors are largely untrained. They're working in conflict areas. We were seeing many complications from the problems that were being created in rural areas, and we realised that the problem was that they were just poorly trained. So we started a program 3 years ago, I should say, to train them, and that's been going really well. We've been measuring pre and post testing after a 2-month course, and we're really finding that their skills are improving, and it's the first time they've actually had practical skills taught to them. Things like trauma care, basic anesthesia even. All of that is very important, and so that's what I do when I'm in Congo.
Which the G4 Alliance is also known as the Alliance for Surgery, Obstetrics, Trauma, and Anesthesia. That's the 4 of the G4 Alliance, which are basically, it's just an acronym for perioperative care yes. around the care of the operating room patient. Can you tell us a little bit how you became involved with the G4 Alliance And how do you see the work of the G4 Alliance furthering the work that you also do in the Democratic Republic of Congo?
Yeah, sure. Um,
And also tell us a little bit about the G4 Alliance as well.
sure. Going back to 2015 when the G4 Alliance was being formed, late 2014, early 2015, as a result of the World Health Assembly Resolution 6815, which was to strengthen surgical and anaesthesia care. And on the back of that, it was felt that there needed to be a major group that would bring everybody together to continue advocating and implementing what was in that resolution. And that's how the G4 Alliance was originally formed. And it just coincided with the fact that we were having an accreditation visit for our newly formed COSEXA program, and one of the accreditors was Professor Pankaj Jani, who was then Professor of Surgery in Nairobi and also Vice President of the G4 Alliance. And I can remember him saying to me, your organisation is doing great stuff in Congo, but you need to join this group. So that's how it came about. And then because I was able to travel a bit more freely than some of the Congolese, I represented the G4 Alliance at those early meetings, bringing it together. So that's where we met, John. And so I've continued in that role representing Heal Africa at the G4 Alliance. The way I look at it is very simple. It brings together, it gives organisations, for example, Heal Africa, which is in the big picture, a relatively small organisation. It gives it a seat at the table in discussions about improving things globally. I remember when I first heard about the Lancet Commission and the G4 Alliance, I thought these are the same issues I'm struggling with in Congo, and that's why we need to work at it both at a on the ground level and at a higher level at multilateral level. So that's what attracted me to the G4 Alliance. It's about networking. It's about collaboration and cooperation across the different projects. Just to give you an example, Smile Train is one of the members of the G4 Alliance. We have a Smile Train project working out of Heal Africa, where we're performing cleft lip and palate. And a number of the members of the G4 Alliance also have projects that are working in Heal Africa, working with Heal Africa. So that gives us interaction both on the ground, as I say, and at the higher level. So the G4 Alliance Strategic Plan 2025 to 27 is, firstly, it's got 4 points: increasing the global awareness of the gap in the access to SOTA care. So that's critical. To the second, countries across the various WHO regions. The third one is to become an advocacy hub for SOTA care, and the fourth goal is to become a global community of SOTA care. For example, the aims I see in the coming year from my role as the president of G4 Alliance is to try and get a more united advocacy group and to highlight the gaps that are still strongly present in SOTA care throughout low and middle income countries. The WHO, as you probably realise, passed the Emergency Critical and Operative Care resolution in 2023 and have now moved on to looking at a more comprehensive, post-COVID comprehensive approach to emergency critical and operative care, and that's fine, but we've got to make sure that the perioperative component of the O of that, the operative, is strengthened, and that's something that we really want to promote, which is perioperative care, the preoperative assessment, the anesthesia assessment, the operative care, and the post-operative care, including right through to rehabilitation. So one of the things that the G4 Alliance is trying to do is to interact with the broader ACAN community. That's the Acute Care Action Network, which was set up by WHO in late 2024 and into 2025. It brings together the emergency, critical and operative care, but we've got to make sure there's good representation of our perioperative teams in that. A number of particularly US-based institutions have become WHO collaborating centres, and that's great, and we've got to keep pushing that barrow, so to speak. I'd like to see the surgical colleges and anaesthesia colleges more united in the advocacy we do too.
Of course, you and I met through our joint work with the G4 Alliance,
Yes.
which the G4 Alliance is also known as the Alliance for Surgery, Obstetrics, Trauma, and Anesthesia. That's the four of the G4 Alliance, which are basically, it's just an acronym for perioperative care
Yes.
around the care of the operating room patient. Can you tell us a little bit how you became involved with the G4 Alliance, and how do you see the work of the G4 Alliance furthering the work that you also do in the Democratic Republic of Congo?
Yeah, sure.
And also tell us a little bit about the G4 Alliance as well.
Sure. Going back to 2015 when the G4 Alliance was being formed, late 2014, early 2015, as a result of the World Health Assembly Resolution 6815, which was to strengthen surgical and anaesthesia care. And on the back of that, it was felt that there needed to be a major group that would bring everybody together to continue advocating and implementing what was in that resolution.
I think I've always thought that the G4 Alliance could be a bridge building organization that could bring different organizations that aren't working together to work on a unified project, and could therefore have some projects that get more support, more funding, and more influence by way of the fact that it's bringing and bridge building these different organizations together. What are your thoughts on that?
Oh, that would be my vision as well. But I think, a donor, a funder once said to me, "Oh, but we don't like to fund advocacy. We want to fund projects and implementation." And I fully understand that. But I think that's the advantage of the G4 Alliance, is bringing groups together, organisations together, individuals together to actually have projects to then say, here's a project that you can fund and go out to. And I think we've got to be better at doing that. I think we also, a key thing I think is there's a new term coming out, health sovereignty, that each government, Ministry of Health, should be also encouraged to fund their own projects, and because that's giving them sovereignty and control over what happens. And I think if the beauty of the G4 Alliance, if we can advocate for those sort of things happening, then through a collaborative approach, through the different membership, we can advocate to ministries of health to, yes, have plans, but not just leave them sitting on the shelf to gathering dust, but to actually implement plans and then go out to look for funders. For example, just to give you an idea, the World Bank, G4 Alliance attends some of the World Bank meetings and advocates to them. The World Bank works through individual ministries of health, ministries and governments, and so if we can produce to a particular government or Ministry of Health and Finance and say, this is what you should be doing, we brought these people together, then they can go to, for example, the World Bank, Global Fund and other organisations and say, okay, we have this, will you help fund us? And there's a number of projects happening like that. The maternal and newborn workers have actually been very good at putting that together, but I think we've got to do that within the surgery and anaesthesia space a lot better than we've been doing. And that's where I see the G4 Alliance is bringing people together to actually do that. A united voice is better than a whole lot of separate voices going to a donor or a funder.
And of course, I work with one of the organizations, the Institute of Global Perioperative Care, which is a member of the G4 Alliance. And of course,
Yes.
we have our own individual projects. But the G4 Alliance allows, in my mind, it allows the opportunity for an organization that may be impacting in some number of countries in some number of way, even something as large as Operation Smile is still focused largely on reconstructive surgery related to cleft lip and cleft palate. So they're still kind of narrow. And so it allows then that type of organization, regardless how small or how large, to then participate in the global advancement of perioperative care, which are presumably the things that that organization believes in and are trying to push forward anyways. So I applaud the organizations that have joined the G4 Alliance and really hope that other organizations that aren't members of the G4 Alliance but are working in surgery, anesthesia, obstetric spaces at a global health way, hopefully they can, more of them can see the benefit, the huge benefit of actually joining and becoming a member of the G4 Alliance. It makes the G4 Alliance stronger. It makes their organization more impactful.
I think one of the things that I would like to see the G4 Alliance doing is better mapping what our organisations are doing in different areas, because I think if we've got a handle on it, we can say, okay, this is what John's group's doing in the Gambia, for example, and you can see this is an example, and that can attract then funding, but also then people may say, oh, we could do that in our country to improve things. So not specifically you, but it allows for expansion and upscaling and things like that. So, but and I'll keep saying it, but I think if we keep working in silos and we keep working in our individual projects, which is great, what is happening, then we won't have the same impact if we come together and have a united voice. And that's what I see as the benefit of the G4 Alliance. That's why we were keen at Heal Africa to be part of the G4 Alliance.
Okay, yeah.
And it was said to me in a surgical context, but it was said to me that one of the problems that surgical colleges and surgical groups have not been good at is working together. And that's been to our disadvantage. We haven't been able to advocate together because everybody wants to do their own thing. And so I see the G4 Alliance as being the natural body that would bring the different groups together, which is why we need to improve our organisational structures and various things. And we've just appointed a new executive director, and I'm really excited about what might happen in the coming years in those sort of areas.
Right. Well, let's round things out with getting your thoughts about the upcoming year of what you hope to accomplish as the president of the Permanent Council. Simply means the president of the organizational part of the G4 Alliance. What are things are exciting about that for you over the next coming year, and what do you want to accomplish over the next coming year?
Sure. Firstly, I'll say internally and externally. Internally, I want to see, as I said, mapping what our organisations are doing, so we've got a better handle on that. I want to see us talking together more. We want to change up some of we have a monthly meeting, which I invite anybody listening to this to join. Anybody can join, you don't have to be a member. I want to see it more interactive so that we're actually discussing across our different organisations what's happening. The G4 Alliance has a number of working groups. That's probably, so the big organisation breaks down into working groups, which are working in different areas, have different focuses, and I want to see our working groups working more cohesively, and also want to see a greater representation in our regional working groups. So, for example, there's an African working group, so to have more involvement in the different WHO regional working groups. There's 6 WHO working groups. So that's the internal participation things that I want to see. I do want to see the operative encounter registry piloted, because as I already alluded to, what I believe is the great benefit of that. So we need to get that pilot done and then work on the whole overall rollout. WHO has a registry in trauma, they have a registry in emergency care, they have a registry in burns, but they do not have a perioperative registry. So one of the things that the G4 Alliance worked on since 2016 was to bring together experts, as I say, a lot of it is networking, collaborating, cooperating, to develop a minimum data set to prospectively collect perioperative data, ranging from where the person, very simple, has to be minimal data set, because the aim is to collect it electronically and to collect it even level 1 health centres and hospitals, because we cannot advocate and we cannot improve quality if we don't have data. Data has to be the powerhouse of what drives improvement and quality improvement. And by having basic data, we can see where the gaps are and upscale. That's the ultimate aim, and to improve quality. So over the years, we've developed a minimum data set which has 24 data points in a core set, and if an institution or hospital has ability to collect more data, then there's an additional 8 data points. That ranges from even just a simple thing like knowing what's the diagnosis, who's giving the anaesthesia, what sort of anaesthesia, who's performing the surgery, and what surgery is performed, and what the outcome is at disposition of at discharge. Very simple, but with that information we can improve quality, and we have worked on that for a number of years in conjunction with WHO. WHO has a secure server. We've been trying to pilot this for a number of years. There's been a few back things that have got in the way of doing this and getting cooperation across a wide range of groups. But to give you an example, we did what we call the demonstration project, a pilot project in Peshawar, Pakistan, and Kenya and Laos in the end of 2023. The hospital, Northwest General Hospital in Peshawar, Pakistan, had not had a significant perioperative database before. They entered 271 cases in this demonstration project. They discovered that they were finding for the first time that the surgery safety checklist was not being used. The ASA was not being recorded. They didn't know what their C-section rate was. And so they found that it was so important that to them that they have now entered over 10,000 cases into that database since the end of 2023. They found that their caesarean rate was 62%, which is far too high. So they have put in now quality improvement and audit processes to actually bring that down, and that's working. Improvement in use of the surgery safety checklist went from 54% to 100%. Their recording of the ASA rating preoperatively went from 0 to 100%. So that just gives you a bit of a handle on how quality can be improved. So the process is that, and we are about to pilot it, we've had 35 expressions of interest from 14 countries. We're about to launch a pilot project, and the pilot project aims basically just to check that the data points are collectible. WHO has a standard of needing data points that are collected to 80% of the time, so that's kind of why we're doing the pilot project. But this hopefully, which will run over a 12-week period, but this hopefully will lead to it being rolled out across the world.
Thank you for joining us for this episode of the Institute of Global Perioperative Care podcast. A special thanks to Neil Wertz for sharing his insights and for helping us better understand the mission, strategy, and future direction of the G4 Alliance. I especially thank Dr. Wertz because since He was in Australia while I'm interviewing him in Baltimore. He was actually participating in this interview in the middle of the night. As we've heard today, improving access to surgical, obstetric, trauma, and anesthesia care is not simply about individual procedures. It's about strengthening health systems, building workforce capacity, and expanding infrastructure and advancing equity in healthcare access worldwide. The work of the G4 Alliance reminds us that safe perioperative care is essential to universal health coverage and to improving health outcomes across communities and countries. If you found this conversation valuable, please share this episode with colleagues, partners, and anyone committed to advancing global health systems and perioperative care. I'm John B. Sampson on behalf of the Institute of Global Perioperative Care. Thank you for listening. We look forward to having you join us for our next conversation.